Welcome to The Explainer, where we break down big topics into clear, understandable presentations.
Okay, so picture this. You've scheduled your surgery. You've already planned your time off from work. You think you're all set, right? Well, there's this really critical step that happens way before you ever enter the operating room.
And this step is managed by a key player on your medical team. And what's fascinating is how their role has totally evolved. So let's meet surgery's unsung hero. We're talking about the anesthesiologist. Now, their role has grown from just, providing anesthesia during the operation to actually managing your entire surgical journey. This is what's known as being a perioperative specialist, which basically means they guide your care before, during, and after the procedure. And this really shows you the shift perfectly. In the past, you might get admitted the night before your surgery for a quick, last-minute checkup. But with so many procedures happening on a same-day basis now, and with patients often having more complex medical histories, that old way just doesn't cut it. Today's model is all about a comprehensive plan, led by an expert well ahead of your surgery date. And the whole process, it really begins with you and your history. It's the first and, honestly, the most crucial source of information for your whole medical team. You know all those questions on that pre-op form, from your past operations to whether or not you snore? Every single one directly informs the plan to keep you safe. A family history of anesthesia problems could signal a rare genetic issue. Mentioning you snore could be a sign of obstructive sleep apnea, which really affects airway management. Even over-the-counter herbal supplements can interact with anesthesia drugs. It all helps piece together the unique puzzle of you. So next up, the team needs to get a handle on your physical fitness, and not just for the surgery itself, but for the recovery that comes after. And the way they measure this might actually surprise you. It seems like such a simple question, right? A pretty common way to gauge your functional capacity. But how accurate is a subjective answer like this when it comes to predicting your actual fitness level? That simple question? Well, studies show it has only a 19% sensitivity for figuring out a patient's true fitness. It misses the mark for about 8 out of 10 people. So clearly a more structured approach is needed. So to get a much better picture, clinicians use this clever scoring system called the Duke Activity Status Index, or DASI. It basically translates your answers about daily activities into a score. And that score gives a way more accurate and objective picture of your body's readiness for the stress of surgery. All right, so after they understand your history and your fitness, the physical exam zeroes in on a few really critical areas for anesthesia safety. From an anesthesiologist's point of view, the airway exam might be the single most important part of the entire checkup. Each one of these measurements helps predict how easy or how difficult it might be to place a breathing tube, which ensures the team is prepared for any scenario that might come up. And this right here is one of the key tools they use during that airway exam. It's called the Malampati classification. It's really just a simple visual score based on what they can see when you open your mouth and stick out your tongue. A higher class, like a 3 or 4, where less is visible, that's a big signal to the team that they need to prepare for a potentially difficult airway. So here's the crucial point. Your risk isn't just some vague feeling. It's a number. It's calculated using validated tools to create a personalized safety profile for you. It's all about data. One of the most common tools is the Revised Cardiac Risk Index. It's a simple but really powerful scoring system. Each of these 6 risk factors adds 1 point to your score. The higher your score, the higher the statistical risk of a major cardiac event after surgery. And that allows the team to perfectly tailor your monitoring and management. And hey, it's not just about the heart. This risk assessment is comprehensive. It's also looking at the lungs. Something called post-operative pulmonary complications, or PPCs, are a pretty big concern, especially after major surgery on your abdomen or chest. So to quantify this lung risk, clinicians use tools like the ARISCAT score. It takes factors like your age, your oxygen levels before surgery, and the type of surgery to predict the percentage risk of lung complications. And you can see the risk just jumps dramatically from low to high scores.
Identifying a high-risk patient lets the team get proactive with strategies like breathing exercises before the surgery.
So, putting all of this information together, it's not about getting a pass-fail grade for surgery. It's way more sophisticated than that. It's really about creating a customized game plan. The goal is to gather all the right information, calculate the risks, and then build a strategy to optimize your health, reduce complications, make the whole process more efficient, and of course, ensure the best possible outcome for you.
And the data shows this modern anesthesiologist-led model absolutely works. Studies have shown it leads to fewer of those costly last-minute cancellations, shorter stays in the hospital, reduced overall healthcare costs, and, most importantly, it results in better, safer care for the patient.
Ultimately, this entire process is the bedrock for your safety and success throughout the whole surgical experience. It's a meticulous, evidence-based approach designed to navigate the complexities of modern surgery. So the next time you're faced with all those forms and all those questions, remember, it's not about them trying to find a reason to cancel your surgery. It's about building a personalized strategy for your success. It really changes the whole perspective, doesn't it?